think, first of all, I was shocked, elated, excited, honored, and humbled. It's a great opportunity to lead healthcare in the community. My management style is to be approachable. I love to listen to what people have to say. Been told that I'm a very good listener. I've been told by folks that I am firm but fair. I do not shoot the messenger. I need to hear what's going on. I need to know what's going on. And I feel like people have to be comfortable talking to leadership. I don't feel that leaders should panic or show an out of control mentality. I think leaders, no matter what's going on, have to present calm, cool, and collected. We have to be poised because people look to us to see what's going on, to kind of gauge the environment in the organization. So that's pretty much my management style. I tell the folks that report to me, you don't always have to agree with me, but when we leave the room, we have to agree on what our consensus is going to be. I feel like if people always agree with their boss or feel like they have to, then they're not doing what we've hired them to do, and that's to think, to bring new ideas to the table, and to help us be the best organization we can be. I love the 30,000 foot level. I like seeing the big picture. I like kind of knowing how all the pieces come together. I like growing people, seeing them succeed. That to me is one of the most rewarding things in my career, is helping people, growing people. I still get communications from people that I have mentored over the years. One of them is now a CEO of a health system in Kentucky, and she sent me flowers when she was named CEO. She said, "Thank you for all you've done for me." The new assistant vice president for Carolina's healthcare for nursing for the whole system, I mentored him when he was a brand new nurse. So it's seeing people succeed. I like seeing people reach their full potential, the opportunities, put those in front of people, see what they can do with them, and all of that comes together then for the betterment of the entire organization. I told the search committee I have 3 major priorities for the first year. And the first one is to improve our relationships with the community, with our medical staff, and with our employees. Because if we don't have excellent relationships with those 3, we don't exist. We need the medical staff, the employees, and the community all working together. The employees and the medical staff are who Blue Ridge Healthcare is. And the community is who we take care of. They're our customers. So we've got to have great relationships there. The second priority I want to focus on is defining and implementing a patient-centered culture. And in that culture, we then need to develop action plans on how we get ready for healthcare transformation and healthcare reform. We're going to be changing the way we deliver care, but the patient has got to stay at the focus of that. And then the last priority for 2013 is to develop a new strategic plan. Our last strategic plan was centered on growth and acquisition, and we've done an excellent job of that. We have a very strong foundation. Moving forward, we need to talk about how we take the resources we've got and deliver the best possible care to this community. I don't expect significant change immediately. I think it will be a gradual change. As I said, we've got a foundation in place. We've worked hard over the last 10 to 11 years to build what Blue Ridge needed to be. Now we've got to take that and figure out what we're going to do with it. So there will be change. I think it'll be gradual. I think the people at the front line are going to be excited because I want them involved in defining how we take care of our patients and how we deliver care going forward. We don't know what the Accountable Care Act is going to mean to us. The government has put a lot of things into place. They've developed a lot of ideas, but nobody has talked about how to make it work on the local level. We know that our reimbursement is going to decrease, but we're going to be taking care of more people, and we're going to be asked to do more and more things. So we've not figured out, no one's figured out, how to make that work. So that's one of the things that we've got to, as we develop a patient-centered culture, we've got to look at how we can take care of more people, take care of them well, and do it with less resources. I am both. I'm very optimistic and I am very concerned. I'm optimistic because we have an opportunity to completely change the way healthcare is delivered, not only in Burke County, but across the United States. In fact, we have to change how healthcare is delivered, and that's an exciting place to be. It gives us, those that have had a lot of experience in healthcare, the opportunity to drive that change. I'm concerned because I do know that it's going to be a major change. We're going to deliver healthcare in ways we've never done before, and I'm not sure what that means to us and how to figure that out. But together with the experts across the country and the expertise we have here, we'll figure out what's best.